All right, aloha again, guys. Sorry for the technical difficulties. I was not able to use Google Chrome to live broadcast today. Apparently, my computer camera or something is messed up, or I need a new version of Chrome or something. So, unfortunately, I'm not going to be doing this on Instagram. I'm only going to do Facebook Live. I'll try to sort this out by next week. Welcome to everyone coming in. I see Cindy, I see Marissa, I see Daniel. So, I don't know, last time I broke it up, just to keep it simple because I don't have the laptop, I'm going to keep it all in one smaller discussion today and try to still answer the questions. Basically, I want to talk about a couple of things today. The first thing is a lot of these questions on hydroxychloroquine, or not hydroxychloroquine, sorry, Kawasaki's disease, okay? So I will talk about hydroxychloroquine and Kaletra. There's a lot of new information on those two drugs, and it's not really that great, to be honest. Unfortunately, well, hydroxychloroquine at least, but Kaletra, some stuff is good. So, also, I just noticed that the quality of the video and hopefully the sound is a lot better on my phone. So I may have to skip doing this on Instagram. Anyway, so Kawasaki's disease. So what is this crazy sounding motorcycle-ish disease that the kids are getting that's in relation to COVID-19? COVID-19, as you know, for a while we've been worried about thrombosis and clots, like younger patients getting strokes in their head and different other clotting things, and being treated recently with clot medicine and clot busting medicine. So what are they seeing right now? Well, there's two studies that are coming out that are a little strange for this Kawasaki type disease. And what does that mean? Kawasaki disease is a really strange disease, but first of all, I want to explain where they found it. They found it in France. I think they found like 21 cases, which over that period of time was very, very strange. It's a very rare disease. It's a sort of disease that we only see and hear about in medical school. Marissa is saying 7 cases now reported in Connecticut, 100 cases in New York. Yeah, so Marissa knows a little bit more, but yeah, the majority of the cases that we're finding in the U.S. were in New York, and that makes sense because we've had the most number of cases in New York too. So Kawasaki's disease is this crazy disease. First of all, it's in younger kids, and sometimes they present in a similar fashion. They don't necessarily have aches and cough and whatever. Now, this is separate from COVID-19. They tend to have fevers and even weird rashes and stuff like that. And one very strange thing they have is what they call, this is always on all our medical school tests, even though I've never seen a single case of Kawasaki disease. And it was obviously discovered by someone Japanese. It's a strawberry tongue. And what does that mean? Well, the sick kid has, instead of a tongue, looks like this. It looks like, imagine what a red strawberry looks like with seeds. And the straw and the tongue looks like strawberry red, not like pink and like a little white. It's got this weird bumps and a red look on it, and that's typical for Kawasaki disease. Now, the reason why it's such a big deal for kids, and they test us on it, is because it can lead to a lot of problems in kids. The number one thing that we worry about with kids getting is aneurysms of the aorta. And if you know what that means, the aorta, again, is the biggest artery coming out of the heart. The aorta and the aneurysm in that is something that's pretty bad. For example, John Ritter, who played Jack in Three's Company, he died of this disease, an aortic aneurysm disease. And sometimes older people will get it, but it's very strange to see it in younger kids. So the point is that you're supposed to be able to diagnose it quickly with kids because they can develop this awful stuff along with clots and other things. They're very confused about why it happens. Even now, they're not totally sure why Kawasaki disease happens. They think it's related to infection, and it's considered a vasculitis. What does that mean? It means that it's something going on where stuff attacks the arteries, the bigger vessels. And Marissa, yeah, they may compare a little to toxic shock syndrome. Again, I want to be clear. This isn't Kawasaki disease. this is Kawasaki disease-like. It looks like Kawasaki disease. And again, a lot of these kids are getting it, and they're noticing that they're not getting it right away. They're not getting it like months after they get it. They're getting it about 7 to 10 days after they get these symptoms. They start developing it, and they've noticed that all of these kids have tested either strongly positive for COVID-19 antibodies or even the PCR stuff, but they test for it. So it's really scary. Now you may ask, well, how do they treat normal Kawasaki disease? Interestingly enough, the way they do it is and welcome to Stacy coming in from Hawaii. Stacy, we're talking about Kawasaki disease in kids, which is very relevant. So again, it's a younger kid disease. As far as I know, people in their teens and older don't tend to get it. Like definitely not, it's not a disease of adulthood. So it tends to be younger kids that get it. I don't mean infants, but usually younger kids. So the way they treat Kawasaki disease is two ways. They don't have like antibiotics for it. They have, number one, they treat it, there's some debate about using steroids for it. And again, as you know, there was some debate about using steroids for just COVID-19. But the number two way, and you'll find this really interesting, is IVIG. So when have you heard this before? IVIG was used for the plasma. This is the plasma that we're talking about when people donate plasma after being COVID-19 antibody positive. So maybe the point is IVIG may also help these kids out. Now, I don't know what studies they've done yet to show whether this same treatment, the IVIG and steroids, works for these kids. But again, it's very scary because these kids, they also end up getting very sick. Not only do they have this fever, beefy, red, strawberry tongue, danger for aneurysms and stuff, a lot of them end up on ventilators, young kids. And again, remember, a while ago in the beginning, we thought young kids were not supposed to be getting this disease. And they weren't getting very sick, or when they got it, they were very asymptomatic and it wasn't very very dangerous to them. But the point is they're finding this out now in France, in New York and Connecticut, as Marissa has shown. And as far as I know, they'll probably be in China and a bunch of other different countries. Now, again, it's just curious why we're only starting to hear about it now. So I don't know whether this is because of a new bad strain, like the one from Europe that got worse and now it's starting to cause this problem. As we all have known, the new sort of danger that we worry about besides the cytokine storm or the second phase of infection is the clotting part, the cytokine storm and the clotting. The clotting is a big deal. And so it makes sense to me that we would have this problem with kids, but even with adults. Again, we're seeing strokes in adults. We're seeing that what they call COVID-19 toes, you may have heard of, and COVID-19 fingers and digits. You're having problems where the arteries, the end arteries and the capillaries and stuff are starting to form clots. I think this brings me into my next... sorry, I got something stuck in my teeth. My next thing I want to talk about, which is a little bit about the clotting. So, again, it's scary for the kids. So we still got to look on this and worry about the studies about what is happening with these kids. Can we protect them with the IVIG and steroids? Or is it something completely different, like just our normal, like remdesivir and the other medicines? So the other thing that we're starting to see is that hospitals are recommending that we start to anticoagulate more and more. Like this is becoming part of the protocols. Remember, the only thing the FDA has officially approved as part of the protocol is remdesivir for really sick patients. And unfortunately, that's an IV drug for hospitalized patients. But now they're starting to say, I wouldn't be surprised. Honestly, my prediction is it's not going to be hydroxychloroquine for reasons I'll go into later. It won't be some of these other things, but they're going to start recommending officially that people give anticoagulation, things like Lovenox or enoxaparin or heparin or something for sick patients to prevent clots for COVID-19 patients in the hospital. Now, I got to tell you, this isn't real game changer or real like something that will help a lot of people, I think, because honestly, we give Lovenox or enoxaparin or heparin to almost everyone in the ICU. Why do we do that? Because generally they're at higher risk of getting clots anyway. And so normally we treat patients with Lovenox or enoxaparin. It's a small injection that you give to them, about 40 milligrams subcutaneous a day, or sometimes 30 milligrams subcutaneous twice a day, to help prevent clots. Because what's going on with patients in ICU? They're very sick. They've got sepsis maybe, even if they don't have COVID-19, and they may be on a ventilator. They're not moving, but the point is they're more at risk of getting clots for all those reasons, especially because they're not moving. So my point is that the FDA regulations or the recommendations, I almost guarantee you the next real official recommendation they'll give will be about giving clotting medicine to protect people and prevent or improve hospitalization outcomes. I think the studies that they did showed that people were either living more, or they were spending less time in the hospital, or had a quick recovery rate. I think that's what they showed, but I have to double check that with the studies. But again, Lovenox will be one of those things, an anticoagulation that we've been seeing a lot, and it will be recommended. So this brings me to some of my older drugs that I want to talk about. I haven't mentioned that much lately for good reason. Hydroxychloroquine is the big one that came out, and everyone was talking about it. Again, Trump was getting a lot of crap for it. Everyone was thinking this is great. People were hoarding it from the pharmacies. Like, everyone's trying to figure out where to get it. And now they've shown, there have been studies, and I think the big one came out in JAMA, the Journal of American Medicine Association, that basically it's not any different if you treat patients with hydroxychloroquine and azithromycin and then compare them to people who don't take it. This is one of the largest studies they did. Again, placebo arm, meaning there's an arm of people that didn't get hydroxychloroquine and azithromycin, and they showed that there was no difference in mortality. And if anything, the hydroxychloroquine and azithromycin people had worse heart side effects. And that's a little sad, because that basically means you're just getting side effects and no benefit on mortality. I don't know if they studied the hospitalization rates, meaning like the amount of days in the hospital, something. But definitely for mortality, there's no difference, and you have worse side effects. Now, keep in mind two things. Number one, this didn't just test hydroxychloroquine. It tested hydroxychloroquine and azithromycin. And azithromycin alone is very bad for your heart sometimes. Number two, so I don't know if it's just hydroxychloroquine that causes problem, or hydroxychloroquine and azithromycin. Number two issue is I also don't know whether this is can be applied to any use of hydroxychloroquine. In other words, this is only used in sicker hospitalized patients. So my guess would be what would be considered moderate to high risk, meaning moderate at least is in the hospital, probably has some breathing problems or lower oxygen, or in the ICU. So the point is, there's still going to be more studies on a hydroxychloroquine. Maybe it may be found to be still useful for other maybe less sick patients. So I'm not saying that there's zero use for it. I'm just saying the data looks still really bad. So the FDA is definitely not going to put it as part of the protocols yet, at least for hospitalized patients. So that's the bad news with hydroxychloroquine. So, we're having some good news with the clotting medicine that we can use Lovenox, and again, remdesivir for all the other reasons I told you before. But again, the problem is Lovenox and remdesivir, these drugs are all given in the hospital. Lovenox is given subcutaneous as an injection, which I guess technically you could give on the outside, but it's a very expensive drug actually. Subcutaneous Lovenox is not cheap. And even remdesivir is an IV drug. So this brings me to another new drug. And I know I'm throwing drugs at you left and right. I definitely want to go into this more for some of you that may be discussing this and have some questions about it. Basically, what I am seeing is some new data coming out about Kaletra. Now, Kaletra, there's a new study, I think it was in Lancet, which is another good, and welcome to Lisa coming in. I think Lisa from my old Herrick's classmate from Long Island is coming in. This new drug called Kaletra. It's ritonavir, lopinavir. It's normally antiretroviral HIV drug. And again, remember, they were testing some of these drugs when they were trying to test for everything, when they were testing remdesivir and were testing hydroxychloroquine and vitamin D and Pepsid AC and all these different things. And welcome to Vinod coming in. So again, the evidence with Kaletra is kind of interesting, but again, it's like Gilead's remdesivir. I don't find it very useful. What the Lancet study showed was they tested, one arm of the study was they took Kaletra, which is, again, the generic is ritonavir, lopinavir, and they tested it with a triple drug therapy that involved this Kaletra drug, which is a pill, interferon, an interferon alpha, and ribavirin. Ribavirin is, hello, welcome to Vinod. So ribavirin is a drug that, for example, they give that's also more expensive to hepatitis patients. And interferon is an IV drug too. So the problem is they showed that this drug did work, that Kaletra helped, but not with mortality, but with recovery. It showed that I think people stayed in the hospital only 12 days or about 12 to 13 days, as opposed to without this triple therapy drug, they stayed like 18 or 19 days. So, I mean, you got to ask yourself, is that really that useful? I mean, it is useful. It helps people get out of the hospital quicker. But my sort of concern is two of them. Number one, it didn't really show a mortality benefit. In other words, these people didn't live at a better rate. It was still about like 20% mortality. Still, people were dying at like 20 to 22%. And then number two, it's similar to the remdesivir problem, which is two of these drugs, interferon and ribavirin, are given IV. And you need to be in the hospital. Not everyone has an IV, so it's hard to start this therapy. It's, again, only useful for hospitalized patients. The Kaletra you could take as a pill outside, but the problem is they didn't just test Kaletra. I'm a little unclear why they tested the triple therapy and not just Kaletra by itself as a pill, and tested, instead of testing Kaletra and ribavirin and interferon all at once. That's a lot of drugs, to take. So anyway, that's the new hydroxychloroquine, Kaletra, and Lovenox study. So again, the good news, we have remdesivir and probably clotting protection if we can do that. Those things are good, okay, for treating COVID-19. The bad news, we've got this weird Kawasaki thing that we're not really type thing that for kids we're not really sure how to treat. I'm guessing maybe it'll be IVIG. And hydroxychloroquine is not very good right now. It's only possibly Kaletra that has been shown to work again. So Kaletra might be a new medicine, but again, a lot of stuff is still pending. So welcome to Fong coming in, Eric coming in, and Todd coming in. So that's all the new drug updates. I'm going to give a quick update later on Hawaii and the world, because a lot of stuff has happened with the phase 1 opening. I've got some thoughts on that. I believe it or not, I know I'm really about wearing masks and doing other things. I actually am happy that Hawaii is opening, because we are doing really well. We're the best state in the nation. We've had 0 cases or 1 case or 3 cases or 0 cases all throughout. So that's, I think if any state is ready for it, it is Hawaii. But I'll get into that later. I want to mention again, a review about antibody testing. And go over it again. As some of you know, again, last time I got the results of my antibody test, an Abbott laboratory test, and I was IgG negative. So again, IgG negative, that means that I don't have any immunity, even though there's a debate whether even IgG antibodies show that you have any immunity. I got it through my doctor because, number one, I'm a frontline first responder doctor. Number two, I had real pneumonia. And so my doctor did order it for me because we were having it available for us in Hawaii. I got it, and it was negative. And number two, it was a very legitimate test. It was the Abbott Laboratories test. That is, as far as I'm concerned, the gold standard for tests, for antibody tests. There are a lot of clinics in a lot of states, if you can go to outside the neighborhood, and they'll charge you $150 cash to get the test. But you got to ask them what tests they have, and you got to ask them what the sensitivity and specificity are. You want those to be as high as possible. You want them to be over 99%. Otherwise, they're not really good tests. I've seen some of these studies where the tests have like 92% or 93%. That's pretty bad. Or even I saw one that was 87%. I think Marissa asked me about one, and it's 87%. I mean, that's really bad. And 87% sensitivity means that 13 out of 100 negative tests are falsely negative, meaning they actually were positive and they were negative. So you basically you have to ask which test you're getting. I don't care if you pay for it. I don't care where you get it. And it will become more and more available. Just like with the PCR testing, in the beginning, they weren't testing everybody. Soon, they will let everyone test for antibody tests, I think a lot more. Welcome to Tracy Yen. Welcome to Andy. Welcome to Ashley coming in from Facebook. So again, that's the update on antibody testing. I think it is good we're having it. It's good that it's useful, but how useful, I don't know. I'm getting less and less, I guess, convinced that it will be something that will be used for antibody testing for immunity. Although, again, if we get a very, very good test and they use it more, then maybe it will be used that way to demonstrate immunity and maybe let you travel or do things like that. So about that, I think I'm going to go into a little bit about and welcome to Chayla coming in, another old Herrick's alum and buddy coming in. So about travel and about the testing, I think one important thing that a lot of Americans are going to have to realize is we are not going to be able to travel to a lot of places. I think you're going to have to plan your domestic travel trips and forget your trips to the Caribbean and Mexico and anywhere international, even Canada. Canada doesn't apparently want us that much, so it'll be very hard for us to go to other states or other countries, I'm sorry. So if you're planning trips for the rest of 2020 or even early 2021, I would honestly plan your trip even to Puerto Rico. I mean, that's tropical, or U.S. Virgin Islands or Hawaii. The problem is, even to get there, you may run into a few problems related to testing, because all of us who are doing really well, again, Puerto Rico, U.S. Virgin Islands, Guam, even Alaska, Hawaii, we're all doing great. Our case rate, look at our curve, is excellent. Again, we have 0 cases, 1 case, 3 case. And so we can reopen again, technically. We've almost stopped community spread, but we're obviously very scared about all the whatever people who are bringing it outside. So I think we're already talking about testing people. Aaron said, Aaron lives in Mexico. Aaron from Mexico says Mexico is still open by air. Land borders are closed for non-essential travel. Okay, interesting, Aaron. And welcome to Matt coming in, my old med school classmate. So again, Mexico, I'm not sure, Aaron, if they're actually testing for antibodies there, but I'm going to tell you, Hawaii for sure is testing with antibodies or wants to on landing. And I've done some international research. There are a few airports that are doing this. For example, I think Seoul, Korea is testing with antibodies. Seoul also, and South Korea, they make you download an app, a tracking app, which I know a lot of you anti-government, whatever, tracking, privacy people are not going to want to do this. So I don't know if that will ever happen in America, but antibody testing is part of landing in Korea. You know where else besides Asia? Vienna, Austria. When you land in Austria, you have to pay 140 euro to get tested by antibody test or by PCR testing to make sure that you are negative and that I think you don't have to quarantine basically if you get that, or maybe you still have to quarantine. But my point is, this is becoming more and more common. And again, Austria is not even an island. Korea isn't even an island. It's in a peninsula, right? It's a Korean peninsula. So these aren't even isolated places. But again, like Korea has a very good flattened curve and they want to keep it that way. So my point is, even places like Hawaii, Puerto Rico, Alaska, I think places that make sense because of geographic isolation are going to probably push for rapid testing. The question is going to be to me again, who pays for this testing? I mean, I did the numbers on math today when I was talking with a friend. So we only have about 700, 800 people coming in per day. Like the majority of those, half of those people in Hawaii are either returning visitors or returning residents or kind of actual like family members or someone that actually is somehow connected here. They're not tourists. The other 400 are either like, crew members or tourists or something. But the point is 800, 900, that's not that much. A year ago today, we were having 30,000 people land, okay? So obviously if there's only 800 people, you can see, okay, well, Hawaii could maybe cover some of that. But let's say the tests are $150 or something like that. I mean, they may only be 100, but let's just say they're 150 because we know it's always more expensive, especially if you add in the cost of contact tracing and whatnot. So 150 times, 30,000, if we had that many visitors a day, actually at the peak, that would be $4.5 million a day. $4.5 million, okay? And that's a day that the state of Hawaii would have to pay if we didn't charge. Over a year, it's something like $1.6 billion. So obviously my point is I think Hawaii is not going to want to pay $1.6 billion a year or, $4.5 million a day just to test all those people coming in. That's not fair. I mean, Hawaii, we're already struggling. We have 35% unemployment. No one's got a job. Like, there's 4-hour lines at the food handouts. So who is going to agree that Hawaii pays for all this tests? My guess will be is that they're going to add this on to the ticket price. This is totally theoretical, but it makes sense. I mean, if Vienna, Austria is charging you 140 euro, then why can't Americans or Hawaiians charge that to come in like a 9/11 tax? And I know that sounds crappy. It sounds like, oh, well, who's going to pay $150 per person, $300 a couple, or $600 a family come to Hawaii? I'll tell you, everyone will pay it because they won't be able to go anywhere else. And yeah, maybe they'll go to Miami and California because those beaches are cheaper. You don't have to pay for it. But Hawaii, there's still a love of Hawaii, and no one can go to really, other places as much, or it's harder. Or even if they go to Mexico or something like that, they'll probably be quarantined, unless they're doing the testing there too. I don't know. Maybe Erin can expound on that because she is in Jalisco, Mexico. I think I'm saying that right. So anyway, Hawaii has just started to phase 1 reopen. We had Flores open for Mother's Day. Again, there's a lot of pushback. We don't really about keeping stuff closed. We don't have like the Michigan protesters and all the other protesters that you're seeing in some of these other states. It is what I would say is that Hawaii is starting to do it, but we are being very careful. We're still allowing surfing and all those physical activities, but people are getting less careful. Like I've noticed the traffic has picked up. They're opening the carpool lanes, and there are rumors. I listened to Lieutenant Governor Josh Green's announcement. He does a daily announcement where he said, I think there are only 2 cases today or whatnot, that there are rumors, or not rumors, there are confirmed reports that Hawaiians are really slipping up. They're throwing garage parties. Like because the clubs and bars aren't open, someone's opening up their garage and having massive parties for Hawaiians. And they're probably not wearing their masks, so that's pretty bad. And also that a lot of the beaches are starting to be packed and people aren't getting tickets anymore. This is very troubling to me to hear this, because even though we may not have as much community spread, we may not be completely clear. There may still be enough in the community, and especially once more and more tourists come, which are more and more coming every day, this is going to become a problem. So we really need to get that testing in place. And obviously Hawaii has a bigger stake in it because a lot of our daily citizen or daily population of Hawaii on any given day is tourists, but even other states, it's very important for the testing, No quarantine here, according to Erin in Mexico, Florida for 2 weeks, Germany for 2 weeks again. So again, talking more about international travel, and I will talk about the other countries and how they're doing later, because every country is sort of opening. And again, I think every single state in America, 40 except for Connecticut and Massachusetts, have some level of phase 1 reopening already. That's a little troubling to me again, and I why from my previous podcast. But as Erin mentioned, Florida for 2 weeks, Germany for 2 weeks once you fly in, and if you have that quarantine, as you can understand, any place that has a tourism industry, no one wants to go there if they're being forced to quarantine. Now, everyone can say, well, how can you really check? How can you test for this? You know, you can say you're going to quarantine, and how are they going to know? They don't lock you into hotels. Like, for example, in Australia, when you land, they lock you into your hotel. You cannot leave. There's a real, and in Seoul, in South Korea, if you're a short-term visitor, they lock you in a separate quarantine hotel. You can't go to your own hotel or relatives or visitor or visit an Airbnb or whatever. In Hawaii, what they're starting to do, they're getting a little smart, a little sneaky. When you check into the hotel, they don't give you a key. They just get you into your room and they don't give you a key. I mean, you can say that if you're with like a couple, you can go out one at a time to enjoy the beach and someone will let you back in. But the point is that if you need a key to get back in, then they're going to, they're probably going to tell on you. They basically report you to the cops. They report you to the cops, and they report you to, I think, the Board of Health and everything. So the other thing, and I think Aaron says that they do bracelets in Hong Kong. You know, Aaron, another place I heard that they do bracelets is, another place I heard they do bracelets is Taiwan, not just Hong Kong. So, again, you know, it could be worse, right? You know, you could say, well, I don't want to deal with this quarantine, but hey, going to Hawaii is a privilege, not a right, as far as I'm concerned. At least you're not getting a tracking bracelet put on you, you know, that way. I don't think that would ever fly. I don't think it's just very anti-American. I mean, I mean, maybe the app would work, but even the app, I think a lot of people would rather get quarantined than get an app on because they think that the government's just going to spy on them, which, you know, it's debatable how it would be used, you know. So again, that's the Hawaii travel update. We are slowly reopening. They're talking about opening even the malls by, I think, May 15th, and retail. I'm not sure how good that will do. And all the later things, which are phase 3 stuff, I don't know what counts as if that's phase 2 or not, but the phase 3 stuff is not going to happen for a while. That's the movie theaters, the the bars, you know, stuff like gyms, things like that. I really, actually, someone can correct me. Maybe the gyms are going to be able to be open soon too. Now, again, as I said, gyms are really bad idea for me. You're sharing equipment, everyone's sweating, breathing heavy, whatever. I would not go to a gym until there's a vaccine that most of the citizens in the US have gotten, at least, you know. So Stefan says, have they said when they expect to allow people to travel to Hawaii without being thrown into prison hotel room for 2 weeks? So Stefan, update on that. I think Governor Ige today, he announced that for inter-island travel, they will allow that. Now remember, even to go from Oahu to Maui, Maui to Kauai, anything else, right now, if you go to a new island, you need to quarantine again, another 14-day quarantine. So Stefan, Governor Ige said that he believes in about 2 to 6 weeks, they will get rid of the inter-island quarantine, meaning that we can all at least go to in Hawaii to other islands without it. But for the normal quarantine, for everyone just flying into Hawaii, Stefan, I don't think they're going to get rid of that, man. Honestly, I don't think they're going to get rid of that. I think they're only going to allow the test, and I'm not the one making the decision, but the way Lieutenant Governor Josh Green is speaking, the way Governor Ige is speaking, enough people are speaking that way that they won't get rid of the quarantine until they figure out a way to test in the hospital a little bit easier, you know, or test in the airport on landing easier. So, Stefan, I wouldn't expect that that they would get rid of the 2-week quarantine. And again, there's ways to cheat around it. They've noticed that, I'm not going to tell you how to do it per se, but let's just say some of the representatives have noted that a lot of people say, oh, I'm not staying at a hotel, like I have a friend or relative, I'm staying with X friend or X relative at this house or that, you know, place, or I'm couch surfing or I'm doing whatever. So I'm not at a hotel. So the point is those people, it's a lot harder to catch them or to, you know, monitor them really, you know, because they don't have an app on them. They don't have a tracking bracelet on them. So, I mean, that's the way some people are getting away with it, but they're still catching people that are breaking it, and they're still giving them a ticket. They're talking about giving a mandatory, no warning, $2,000 ticket now. Remember, it used to be $1,000 or $5,000 possible, but no one was really getting it. Now they're saying $2,000 mandatory, no warning. I mean, that's a big freaking ticket. For most people, that's the cost of their entire holiday to Hawaii. So I don't, again, I don't know if they're going to start testing people more or checking on people more. Like, one easy thing I thought of is, if you're going to track someone, you get the phone number when they land, make sure that phone number works for them, and then you call them and you make them show, you video camera, FaceTime them, and then you make them show where they're at. If they're outside of the house, they lose. They automatically get ticketed. You can just check them, or you can give them a warning one time if they're outside the house, and then after that, they have to stay in. Again, it's hard because no one wants to go be a tourist in a place where you're going to have a 14-day quarantine. So this is a really tough thing. And again, Hawaii is suffering. Everyone wants to reopen. The hotels on some level, the restaurants, obviously. Our famous bars, our Irish bars are all closing. Stefan, I don't know if you heard about this, but the owner of Kelly O'Neill's Irish Rose Saloon, Murphy's, and Anna O'Brien's, the 4 major Irish bars in Hawaii, is saying he's gonna close because he doesn't have enough money to keep everything going. So that's pretty bad, and very sad that we're losing these institutions, really. So that's a little bit about Hawaii. So Hawaii, I have some hope for, and we are reopening. But again, we're the state most ready for it. Who's not really ready is a lot of other states, including, I know, and this is near and dear to my heart, my second home is California, and my parents are there in Orange County, and there have been a lot of protests there too. But if you look state by state at the curves, the California curve is still going up. It hasn't flattened that well. It's still going up. They're increasing new cases each day. The Texas curve is still going up. Actually, even though New York got hit hard, it is going down. Georgia is kind of going down. Florida is going down. And Hawaii is way down. One thing they noticed, by the way, they did some tracking data in Florida. And while I was sure that Florida would do really poorly, in actuality, they're finding Florida did really well. And their theories on why are, number one, they have a lot of old people that were frightened for their lives and just stayed put and really did follow the rules. All those spring breakers are maybe not even from Florida. They're from other places. And number three, they noticed by cell phone data that a lot of Florida people were sheltering in place even before the governor of Florida told them to officially do it. Erin says Florida opened hair and nail salon today by appointment only with a 15-minute gap for cleaning between appointments, masks must be worn by the employees. So again, I understand this is hard because a lot of small businesses, hair salons, nail salons. Now, you can argue that there is zero ability to social distance. If your definition of social distancing is 6 feet away, you cannot give someone a manicure or pedicure or a haircut from 6 feet away unless you're a Jedi Knight and can use the Force, on your clippers and this person's hair. So, I mean, my point is again, I'm not saying you're definitely going to get it if you go there. And they can be very clean about stuff. But I just think it's a high-risk area, just like gyms are a high-risk area. I personally will not be going to get my hair cut as long as I can, cut my own hair, which again, it's not bad. I'm getting ready to shape it again later, and I don't need my freaking nails done. I believe it or not, I don't get pedicures and manicures, even though maybe I need a pedicure. I'm just saying everyone's got their risk tolerance. I'm not saying you're definitely going to get it there. I just think if you rank things from surfing on the bottom line to hiking in nature, up all the way to, let's say, hair salons and gyms and nail salons, those are opposite ends of the spectrum of risk. Or even bars and crowded bars and restaurants, So as, you've seen these states open, everyone's seeing all the bad stories, all the no one's wearing their masks anymore, people are just whatever, and everyone's starting to feel safe, right? Because they're not getting sick right away. Todd, yeah, I will. I've learned the scissors. This is why it looks cleaner. I cleaned it up with the scissors. So yeah, I know that. Now I know. By the way, I'm just using kitchen scissors, but it is working. So, my point is, right now, people feel pretty invincible, I think. And they feel invincible because they are not that sick. They don't know. Outside of New York, honestly, I know one friend in Texas, and that's sad. She had 2 uncles and 1 aunt die, but they were all over than 65 and sick. But again, a lot of people in America don't know they may know someone who got COVID-19, but a lot of people don't know someone who's died of it or a relative that is in the hospital for it. So I think people are getting this false sense of security, and they're like, oh, we're opening up again. Again, the stock market's doing well. People are, we're starting to see less shortages in Costco. For the first time, like 2 days ago in Walmart, I saw hand sanitizer on the shelf, lots of it. And there's pasta on the shelf. There are a little bit of meat shortage stuff, but like people are finding toilet paper and paper towel stuff easier. So people are relaxing a little bit. This is like that time in the movie. Again, this is like the time in the horror movie where you think you killed the dude, or, like Michael Myers, or like Fatal Attraction, like Glenn Close in the bathtub, which is probably a movie reference that's dating me, and then you turn around and you think everything's good, and they come at you and you get hurt again. And this is what I really do think is going to happen. So I know a lot of scientists again have been saying, oh, we got to be ready for a second wave in the fall. I think that's still absolute like best case scenario, that we don't get another bump. By definition, look at every other country: China, South Korea, Singapore. These are countries that did really well, with the exception of Taiwan. Every other country has hit a second wave, unless you're counting that still as the first wave that's still going up. But I consider it technically a second wave, because you stopped and started phasing back in, and now you're hitting it again. So in my mind, that's a second wave. My point is, every other country's had that already. So why do we think we're going to be different again? I really think we're going to have to start rephasing down again by June, or July latest, after we've already started phasing back in, phase 1, phase 2, phase 3. All of May, everyone thinks that's great and feeling good. I really think people are going to be sort of demoralized and depressed again by end of June and July, as you see the case count go again. But this time, there's a good news and bad news. The good news is that we will be much more ready to fight it. Everyone will have their masks already. Everyone will know how it works. Everyone will know, what things they need to, possibly stock up on again, or, whatever. And they'll be ready for it, and, they can take it seriously again. The bad news is, I think there's going to be a lot of frustration, and a lot of people are saying, why do we have to do this again? It's not that bad. Like, we still don't see the hospitals overwhelmed. We still don't see the ventilators overflowing. So there's going to be a lot more pushback on that, I think. There's going to be a lot more pushback on people when we hit a second wave to reclose, to phase down from phase 3, phase 2, phase 1. Again, most of the states are in phase 1 right now. And they have different definitions of what is allowed for phase 1 or phase 2 or phase 3. So, while I'm happy that we're all opening up, just keep your eye on the ball and keep a look at your state's numbers for the end of May. Again, we opened May 4th to May 6th. So 14 to 17 days after that will be May 18th to May 21st. So really, by the end of this month, I think we may start seeing more cases, because again, as I'm seeing, all the people who are going out again are not wearing their masks. They're not wearing they're not social distancing the right way. So, this is something that hits you later. It doesn't hit you right now. And we know this, but we're not acting like that. So that's what I'm concerned about for America as a whole. So internationally, I guess more updates is that, again, Trump today, I know, I don't want to get into politics and stuff, but we're all bragging about how many tests we've done, right? And as everyone knows, the tests are important for opening up the country or doing things. They bragged about 9 million tests, and we're going to do even more. And yes, we're doing, triple the amount of tests daily now that we're able to from a month ago. But 9 million tests, again, this is not that much. What's the population of America? Something like 370 million. So 9 million tests, that represents less than 3% of America that's tested. That's really not that much. That's not many tests per million. That's not a great thing. Again, our deaths per million, deaths per capita, are actually better than a lot of other countries, especially all the Western European countries, UK and Italy and Spain, and and even Sweden. We're doing better than Sweden. I know everyone keeps saying Sweden's doing well, but their death per capita is worse. The argument is that Sweden, if you were to test them right now, all at once, they have more members of the community that have herd immunity, more members are positive for COVID-19 and have recovered, and they're trading early deaths now in the older population for fewer deaths later. And we're hiding all those people, so all our deaths are still going to come. I don't know that, it's hypothetical. I think that may be true on some level, but I don't know. I mean, and how long are we going to have to hold old people for? There is that argument that, again, you will have to, why don't we just open up society to the healthiest younger people and let the older people be locked up for the rest of the year and through next year until the vaccine comes. Here's the problem with that argument. CNN made some good point about this. Not that I love CNN, but the point is you can't just assume because you're younger that when you get sick, you're not going to have a problem. Now, remember, anyone with any comorbidities or any risk factors, whether you're old or not, has a bad problem with this. So just think about if you're under 40 years old or even 45 or whatever, because I have some older friends. Think about how many people you know who have asthma, who are overweight, who have high blood pressure, who have diabetes. How many people do you know of those that have just those 4 diseases alone, or like kidney disease or any lung disease, are under the age of 50? There's a lot of people under the age of 50 and even under the age of 40 that have those diseases. So Greg asks, have they figured out what the reinfection rate is yet? Last I heard, it's thought to be around 12%. Greg, I have not seen the latest studies and data. I've been reading a lot of the drug articles recently. But if you see something, let me know. 12%, that's interesting. That's I don't know, that's scary. It's interesting trivia. And again, Greg, as I mentioned, part of the problem with that is I have to see how they're defining reinfection. Because again, remember, there were studies in Korea and China that show that people were getting, quote, reinfected. But their definition of that was the PCR test, where they were testing, again, for viral particles. And they didn't know whether they were actually virus that was alive or just dead parts of the virus. And you weren't actually getting reinfected. So I'm a little unsure about what reinfection means. Does reinfection mean you just find that you actually are infected again and can get sick again, number one? Does it mean you're infected again but don't get sick, but you can make someone else sick, number two? Or number three, is it just kind of much ado about nothing and you just have more viral particles and you're what we call colonized by it? For example, sometimes when people get Staph aureus or methicillin-resistant Staph aureus, we test them all the time in their nose. And they have it. They're colonized. And they have it there all the time, but they're not getting sick. They're not getting massive skin infections or whatever. They may have had one before, but now they don't have it. But when you test them in their nose, like even a month or two later, they still have it, but they're not actually getting sick from it, at least not right then. So, Greg, I don't know what the rates are. I'd be interested to see what you find. And I don't know whether it means you can get sick again, number one, make someone else sick, number two, or number three, it doesn't mean anything, and it's just viral particles, not a real reinfection, okay? Todd said, how did India keep COVID at bay? Any lessons we can learn from them? Todd, that's really interesting about India. I am looking at that more. First of all, Brazil was not hit as hard, and for a while I was thinking Brazil escaped it too, but they're saying that the favelas are actually getting really bad, and funny enough, this is like a bad end of the world movie. The gangs in the favelas and the slums, like India has, are doing things themselves because like they have their own law enforcement system. So Brazil is getting hit pretty hard, but maybe not as hard as I thought. India, I don't know. India, it's really interesting because if you look at it, look at India compared to like Russia. Russia's getting slammed. I think officially Russia has the third most number of cases now. And everyone in Russia is starting to freak out because before they weren't getting a lot of cases. And you can say maybe Russia just wasn't testing enough. So Todd, how is India keeping COVID at bay? These are just theories, but I believe India, number one, I don't know if they're testing enough. And if you're not testing enough, then you cannot say how many cases you're actually having and how many, how much, mortality you actually have, because you don't know, how many of those people are actually dead, right, from COVID-19. If you're not testing anyone, then how can you say what the death rate from COVID-19 is? I'm going to check this real quick and see how India is doing with this, just in terms of tests that they're doing per capita. And India, okay, I got to tell you, Todd, I'm looking down in India, man, they are really, really down there. They have not barely tested anyone. India has only done about 1,213 tests per million people. That's down by Guyana and Senegal. And interestingly enough, for you, Aaron, if you're watching Mexico, only again 1,200. To put it into perspective, the US is doing 29,000, almost 15 times as many tests, or actually, almost 20 times as many tests as, or actually more than that, as India is. So they're not really doing enough tests to show. And again, Russia's doing a lot of tests now. So now they're starting to see a ton more cases. And again, the number 3 country in the world for amount of infected people, just total cases, not like per capita cases, is USA is number 1 with 1 million cases, about 1.04 million. UK is 190,000, and number 3 is not Italy or Spain anymore, it's Russia. Then France, and bringing up number 5 is Brazil. So Brazil is getting hit hard, and India is number 9. And India is at 22,000 cases. Now, again, I don't think most of these other countries have been doing the tests that we have been doing. So, I think that's a little scary. Internationally, I still think the other shoe is going to drop, and we're going to see that as other countries ramp up their ability to test, we're going to find that a lot of other countries are doing a lot worse and have more deaths because of COVID-19. So obviously, you can't say that people have died of COVID-19 in another country if you haven't tested enough for COVID-19, right? You can't say that at all. It's just logical. So it looks worse for the US because we've tested a lot now. We haven't tested the best. The best per capita testing country is not the US. The best per capita testing country is something random like Iceland. Iceland has tested 158,000 people per 1 million, but they're tiny. Iceland only has like 1.3 million people. They're the size of England, and they only have 1.3 million people. So they've tested about 10% of their population, or a little more than 10% of their population. But all the rest of the other countries that have tested really well are the small ones like Malta and Cyprus, Lithuania. That's a really good thing for some of my Lithuanian friends. They're doing very well there. Portugal, Estonia. But again, the ones that aren't testing as well are the UK. The US is still kind of down there. And, a lot of other countries are not quite testing per capita as well. And so we have to watch out for that. So I think I jumped around a lot today. Again, for everyone joining late, in my earlier talk, I did talk about Kawasaki disease and why it's a little scary and why we're seeing it in Kawasaki disease like disease in children. I talked about anticoagulation with Lovenox and why that's really important. I talked about the real new bad data about hydroxychloroquine. Basically, we're not going to see it being used much anymore, honestly. And the good news, or slightly better news, about Kaletra, even though I don't think it's that useful. And I kind of gave a little bit update about antibody testing and Hawaii. So, I think I'm going to cut it now. I think I've been talking for almost an hour. Sorry about the delay. I'm having trouble broadcasting live except from my phone. So I couldn't do it on Instagram Live this time. But the quality is much better because I am using my phone, as you can tell. And I can't do it on Google Chrome or whatever. So I think I'm going to end right now. I am off of work all week. I've been relaxing. I've been getting my tan on. I found a new nice surf spot. And yeah, Todd, the reason internet was good is because I'm going on my iPhone on LTE. So maybe from now on I'll do this. I'll just stop doing on Instagram Live because most of my visitors are coming in from Facebook anyway. I'll just, tell people that, unfortunately, it's hard to set up two phones to do Instagram Live. Maybe I can get a new old phone or figure out how to do Instagram Live and Facebook Live on my phone, but I don't think I can do both at the same time. So that's it. Thanks a lot, guys. I'll be back on Thursday. I will try to shoot again for the 4 p.m. time. It seems like I get most of, or 4 p.m. Hawaii Standard Time. I seem to get most kind of participation then. And everyone, again, stay safe. Stay safe with your phase 1 reopening. Again, I'm not against it. I just want people to be safe and do it the right way. I would still wear the mask. I would still avoid all the awful places. I mean, it's the common sense things. Don't go to garage parties. Don't go to gyms to share equipment. Don't go to buffets if, God forbid, there's a buffet around you somewhere. Don't do stupid things like that. I mean, you don't have to be a doctor to realize how you can stay clean. So everyone, again, David Morris, anesthesiologist, all our frontline defenders and first responders, nurses, doctors, anyone in healthcare, anyone in a essential position, even if you're working at a restaurant handing out takeout, doing anything, stay safe. We will get through this, and I think we're doing better. And even if we take a step backwards, it'll work in the end, and we know what to do. Okay, so aloha, guys. Again, I'm the traveling doctor, Dr. Albert Lin. Again, add me on Facebook. I'm going to be sending out some suggestions. Hopefully, you can like my page. Add me at the traveling_MD on Instagram, at the traveling DR on Twitter, and just search for the traveling bachelor or the traveling doctor. Search for the traveling doctor on Facebook or YouTube, and my videos will be saved all there. Okay. Thanks a lot, guys. Aloha. Bye.